three types, four types that we're gonna talk about. Non-adjustable, semi-adjustable, fully adjustable, and a class 2. Non-adjustable is a class 1, and it has semi-condylar inclination, and it moves in a straight path, so that's gonna be a protrusive movement. Full condylar inclination has a curved path, and so that will be as you're riding down the condyle, and that movement will be seen in the sagittal plane. So for both of these movements, non-adjustable, class 1, movement seen in the sagittal plane. Next one is semi-adjustable, which is a class 3, and the movements are the condylar inclination, ICD, which is intercondylar distance, lateral translation, and Bennett movement. So again, all of these movements can be seen in the sagittal plane and also the horizontal plane. The fully adjustable will allow for all 3 planes of movement, will mimic most natural condylar movement, and it will be curved condylar path, Bennett angle, ISS, rotating condylar movement, ICD, and yeah, so it will mimic an actual TMJ joint. So in our case, we're going to be using the Archon type, which is a type 3, which is when the condyle is attached to the lower portion, and this resembles a TMJ. A non-Archon type is when the condyle is on the upper portion. So that's the difference between these two. So remember that. Why do we use an articulator? For diagnosis, treatment planning, and just treatment in general, because it allows you to build the tooth outside of the mouth, so you're not just inside the patient the whole time. And then for semi-adjustable requirement, you need to do a Facebook transfer on the patient. You need to measure the centric relationship and MICP. Is it measure, or you need to match?
You need to determine it basically.
Determine it.
Like get the proper MICP
Okay.
and centric relation if they have.
If they have, okay. And then your eccentric occlusion is required for lateral and protrusion. So these are the things.
And did we do class 2?
Oh yeah, sorry, class 2 we don't really talk about because
It's not important.
it isn't relative to the TMJ. So the measurements that you're taking are vertical and horizontal motion, but they are not relative to the part of your jaw that is important.
Perfect.
Cool.
Thank you.